As Winnipeg grapples with a growing housing crisis, tent encampments have become a stark and visible reality across the city. In parks, under bridges, and along riverbanks, makeshift shelters highlight the struggles of those who have fallen through the cracks of the housing system. Rising rents, a lack of affordable housing, and barriers to accessing emergency shelters have left many with no other option but to live in these encampments. The presence of these communities has sparked debate. Advocates argue they provide a sense of safety and stability for those experiencing homelessness, and city officials and residents raise concerns about public safety, sanitation, and long-term solutions. As temperatures drop, as they are right now here in the winter months, the urgency to address the crisis becomes even more pressing. This Tuesday, February 18th at 2 p.m., the Music and Maven's concert and lecture series at the Rady JCC will be hosting a lecture that touches on some of these challenges. Called Homeless Encampments and Community Wellbeing, this lecture will be hosted by criminologist and associate professor in the Department of Criminal Justice at the University of Winnipeg, Dr. Katharina Maeir. Katharine Maeir has spent her professional career examining issues around the criminal justice system, focusing on prisoner re-entry into society, penal supervision, both during incarceration and after release, halfway houses, urban poverty, and social marginality. This is going to be a fantastic lecture on Tuesday, and joining me here in the Classic 107 studio to talk about her lecture, Homeless Encampments and Community Wellbeing, I am joined by Dr. Katharina Maeir. Hi, Katharina. Nice to have you here.
Hello. Thank you so much for having me.
First of all, the topic of encampments is so nuanced and complicated. When I was writing the interview, I was thinking every question could be a dissertation. But giving the broad strokes, as someone who deals with the issue, what are some of the challenges of people who live in the encampments? What are they dealing with?
At the core, the challenge is housing. So people who stay or live or choose to erect a homeless encampment lack housing, or they lack, and I always highlight this, accessible, affordable, and most importantly, safe housing. So there's a lack of housing that is one of the reasons why people may choose to live in an encampment. But there are many other obstacles that unhoused community members face, and we can talk about some of them. So we have research which shows that unhoused individuals face a higher risk, much higher risk of victimization and violence. And this includes issues such as gendered violence, hate crime, theft, robbery, assault. These risks stem from both people outside the street community and people within the street community. But these are risks and plentiful risks that people who stay at homeless encampments or people who live unsheltered or sleep rough must navigate often on a daily basis. We also have research that shows that addiction, drug use affects unhoused community members at higher rates compared to the general population. And so here we have concerns about the toxicity of the current drug supply, concerns about violence and victimization that can be associated with the current drug supply, and a lack of harm reduction and treatment options. And in our research, we find that even people who are unhoused and who don't consume drugs are still affected by the toxic drug supply. So really, the current drug toxicity crisis is in many ways shaping people's lives on the street. We also find that women face different risks compared to men. Transgender people face different risks compared to other people who live on the streets. So really the obstacles are plentiful, but at the core of it, of course, it is a lack of safe and accessible housing.
And affordable housing.
And affordable housing. And oftentimes, I mean, these issues intersect.
Yes.
If you don't have housing, it's very, very difficult, if not impossible, to find stable employment. Without housing, it is much more difficult to seek out harm reduction, treatment supports, mental health supports. So all of these social issues and structural issues that people are currently facing intersect.
As someone who deals with this on a daily basis, how do you stay impartial? I mean, for myself, I know people who can make compelling arguments for the encampments and others who make compelling arguments against the encampments. First of all, for example, like what do you say to the homeowner in Point Douglas who has an encampment close to their property? There's used needles on the ground, and public sanitation is an issue. What do you say to a person like that?
I mean, it's complex. I mean, I would first of all validate their concerns. I don't think there's any point just saying, well, this is just what researchers would call like NIMBYism, like not in my backyard, just, unfounded concerns. I think we need to take people's concerns seriously and validate them and then see how we can address them in a way that provides safety to people living on the streets and the general population. I understand people's concerns, and I think it really highlights the need for government at the municipal, provincial, and federal level to act. Part of validating their concerns, I think, is also education, telling people why are people in homeless encampments, why have these encampments proliferated, and why may people choose to stay at an encampment compared to an emergency shelter, for example. So I think a big part of it is humanizing people who live on the streets because there continues to be a lot of stigma, a lot of stereotypes. So it's about humanizing unhoused community members and at the same time taking people's concerns seriously and showing these concerns need to be addressed and how can we address them via harm reduction supports, via housing, but also perhaps, because of course here we're talking about more long-term structural changes that cannot be implemented by tomorrow morning. Is there anything else that cities can do on a short-term basis to enhance community safety for all? So for example, I mean, you mentioned concerns about needles and syringes. So I mean, part of alleviating people's concerns would be saying, we take this seriously. This is a concern. Risk for the general public in terms of disease transmission is low. We know that, but still we need to address this. So on a more like low-hanging fruit and short-term, could we provide more services to encampments in the short run, such as ensuring there are available garbage bins, safe places where people can discard needles? What can cities do to provide short-term services while people are staying at the encampment?
Right.
So that's what I would say. But I think it is always needs to be two sides. It needs to be validating people's concerns because they are serious, and we can't just say, well, deal with it, or. But at the same time, educating people, humanizing the people who live on the streets, and really taking all these concerns together to push government to act, because we're in such a dire situation where action needs to happen.
Yeah. And then, like, on the other side, what do you say to those living in the encampments? I mean, do you empathize with their desire for, like, refuge and community? And do you understand, like, the housing crisis here in Winnipeg? Like, what do you say to those who are living in the encampments?
Well, I mean, I absolutely empathize with them. And I understand the housing crisis, not just in Winnipeg, but it's really across the country, not just in urban cities like Winnipeg or Edmonton or Regina, but also in many smaller communities, have also seen an increase in visible homelessness and encampments. And I mean, what we've seen in our research, and we've talked to hundreds of unhoused community members, including people who live in encampments, is that people come from all walks of life.
Right.
So, I mean, we have talked to people who were journalists and became homeless. And at the time when we interviewed them, they were living in a homeless encampment. And their life changed rapidly. We talked to people who were cooks and had a very good life. And then they were in an accident and they got addicted to opioids. And things spiraled out of control. We've also talked to people who spent most of their childhood in foster care, people who spent many years in prison and returned from prison onto the streets, didn't have housing. We've had people who told us, I didn't know where to go. I was a survivor of domestic violence, and I called police, and they told me, well, these are your options. So, I mean, it's such a complex issue, and it is a really, really humanizing issue. And I think understanding all the different pathways that can lead somebody becoming homeless.
It doesn't take much for somebody to end up on the street.
Exactly. It really doesn't take much.
Yeah, absolutely. Do you get the two sides talking? Like, how do you get the two sides to understand each other's viewpoint? Is that even possible?
It has to be possible. I mean, we have to, we can't operate in silos. And that's for people who hold different opinions, and that's also for different government agencies. I'm sometimes concerned that we have very black and white discussions when, especially when it comes to issues such as homelessness, policing, addiction. These are complex issues, and there are many shades of gray. As an empirical researcher, I always look at the data. So for me, I mean, we've done interviews with hundreds of interviews with folks living on the street or people who spend time on the street, most of whom use drugs. So I am interested in what people have to say in their concerns, and I would bring these concerns forward regardless to who I speak, because data are data, and I think we really need to listen to people's narratives. Both people who live on the streets, and then also people in the community, law enforcement, social service agencies, community-based agencies. But I think a big part is really understanding, and I mean, for the research that I do in particular, understanding people whose voices are often neglected or ignored.
Right. I know the province announced a while ago that they're planning on buying properties with the idea of turning these buildings into shelters for people. I think the figure that was $20 million was what they were going to spend. Do you think this plan will work?
I hope it will. I mean, I think just seeing the plan, seeing the provincial government take action is very, very important and something that I've really appreciated. And I've appreciated reading the plan, and I think there are some things that are really noteworthy and that really stuck out to me in a very positive way. So one is investing in longer-term solutions. So traditionally, governments have often invested in shorter-term solutions, such as increasing, let's say, beds in emergency shelters. This is also very important, but we also have research on the many barriers to why people do not access emergency shelters. And that's not to, undermine their importance, not at all, but we really need solutions that invest in longer-term housing. And so, I'm hoping that this is part of the plan, or I see this as part of the plan. The other thing that really stands out to me as positively is that there seems to be an understanding that we need to wet housing services with harm reduction services. So an approach that only responds in terms of housing is not going to work, according to the research that we've done, because of all these intersecting barriers that people face, such as drug use. So it is very important to merge housing services with mental health, harm reduction services, social services, counseling, and so forth, and to continue that. It is very difficult for people when they have to navigate really complex systems. It is much easier when there are wraparound services, and I think the term wraparound services is explicitly used. And so to me, that stands out quite positively.
Yeah, absolutely. I was listening to an interview along those same lines with somebody who's living in an encampment, and he made the point that people who live in encampments are much more likely and they're much more receptive to moving and change if it's brought about by community leaders and people who understand their issues, as opposed to, say, the municipal worker who's just doing a job or a police officer. Would you agree with that statement from your experience?
Well, there needs to be a relationship of cooperation and trust. I mean, forcing people into housing or treatment may not be the best solution. So it is important that there's a relationship where people feel they trust the person. They think this is, a thing that will benefit their safety and well-being. And we have research which shows that some people have more trust in people who share their experiences. So people with other lived experience, let's say. And I think it's important that we have responses that are multi-agency or multi-actor led.
Right.
This includes Indigenous led or responses. This includes mobilizing community organizations. So, yes, I would also say, though, that we need a very localized response. I think it is good to have standard guidelines for certain things, but any response to homelessness and addiction must pay attention to the particular local nuances in a city. So, I mean, in our research, we've been to cities where people had positive perceptions of police and actually said, well, relationships have improved, things are working well. And in other cities where perceptions were more negative.
Right.
So again, it's much more complex, and I don't think there's much use saying, well, this actor, law enforcement, is always bad, or this actor is always good. I think we need to look at the particular situation in the city and figure out what works best to build relationships of trust and to ensure that these solutions are going to work long term. And certainly, I think in Winnipeg, a multi-agency response, which again I also see reflected in some of the provincial responses, could be a good way.
Do you think education plays a role in that? Like, I'm just thinking about education of like police officers and those who may be in contact with people who live in encampments.
I mean, education, training can all play a part, and I mean, I think that's, you're raising a good point in that it's not just who does it, but how we do it. So we've seen in our research that when actors, including law enforcement actors, private security, take a more harm reduction approach to their work, this benefits relationships of trust. So this could include things such as checking in on people, having people around who are willing to administer naloxone, having people who are willing first responders. So it is not just about the who, but it is also about the processes. And so, yes, I mean, to your question, education, training certainly can play a role there.
Yeah. I was listening to a podcast that you did with, it was for the National Collaborating Center for Infectious Diseases, and you've been touching on it throughout the interview, just sort of these intersecting lines. And one of the points that you brought up was the importance of the follow-up of healthcare for people who are coming out of the prison system and transitional care for prisoners. I know that is part of a population in the encampments. Can you briefly talk about the role of transitional housing and proper health care and what that plays in the amount of recidivism and homelessness that occurs with prisoners?
Absolutely. So there is so much robust criminological research that shows that housing is one of the most important factors in terms of reducing recidivism. So recidivism, we're essentially talking about rates of reoffending. And we find that people who are provided with safe and stable housing post-release from prison have much better chances, are in a much better place to rebuild their lives, which includes living a life free of crime. We also know, however, in Canada and many other places, that not all prisoners who return from prison have access to housing, and as a result, they may return to spaces that they may have tried to avoid, and return to unstable living situations, have to sleep rough. So again, for the post-prison stage, housing is one of the most important factors in terms of reducing individual recidivism. And then, I mean, on a more societal level, ensuring public safety. Same goes for connecting people with healthcare services when they come out of prison. So it's, we have research which shows that people may be connected to certain health services while incarcerated, receive medication. But if this sort of care does not continue post-release, then again, people have very, very limited chances of rebuilding a life that will allow them to desist from crime and live in well-being, essentially.
Right. Yeah.
And the issue in particular is that when it comes to federal incarceration, there are resources such as halfway houses. There are more transitional resources. When it comes to provincial incarceration, there are fewer resources. That's not to say there are no resources at all and no housing supports, but certainly much more needs to be done to ensure that the transition from prison back into the community is smoother, because currently people face so many obstacles. And again, we were talking about people's concerns earlier in terms of ensuring public safety. Yeah. We really need to invest in people's individual well-being, because we have all this research that shows that when we provide people with stable housing, access to treatment, employment, all of these things have a positive effect on people's likelihood to not reoffend.
Yeah, I mean, part of not reoffending is having a job and being gainfully employed, and it's really hard to do if you don't have a fixed address, right?
Absolutely, yes, yeah.
I want to turn specifically to the lecture on Tuesday. It says it will provide suggestions for relevant municipal policies and projections addressing homeless encampments. Again, big, nuanced topic. In broad strokes, can you talk about some of the points that you're going to be making on Tuesday?
Absolutely. So the lecture will take a broad approach to talking about the intersections between drug use and homelessness first. And I will discuss how the current drug toxicity crises are shaping people's lives on the streets. And with this context established, I will show how erecting and joining and living in a homeless encampment has been one response, how unhoused community members try to build a sense of safety and navigate some of the risks of living on the streets and some of the risks that are associated with drug use, with a toxic drug supply.
You're talking about fentanyl and...
Well, I'm talking about fentanyl. I'm also talking about methamphetamine, benzodiazepines. So in the lecture, I will show participants data. So again, these are narratives from people. We've done ethnographic observations, interviews with people on the streets, people who live in homeless encampments, where they tell us why they chose to, let's say, join a particular encampment. I'll talk a little bit about how these encampments are socially configured. So it's really interesting because, I mean, encampments look very different, but we've been to some encampments where people took on very clear roles,
right.
Such as, this person is in charge of solving conflicts if they arise. This person is in charge of cleaning up the camp. Other people are in charge of going out into the community and getting food. Other people are in charge of looking after each other's tents, right? I talked about issues such as theft earlier. So some of these are responses to the risks of victimization that people face on the streets. At the same time, this is not about romanticizing encampments or providing a sanitized view of them. It is showing why people join an encampment, how they organize life, because some of them are quite organized spaces. Again, where are these
little societies?
Yeah, social norms, potentially informal consequences. If you don't abide by the rules, there can be consequences. So I'm going to talk about that. But then I'll also shift and ask, well, what can municipalities do to both, support people who live in encampments, but also to deal with some of the concerns that we talked earlier. And I mean, when we look at the situation in Canada, what really stands out is that there's currently a lack of guidelines for municipalities to deal with the issue of homeless encampments. Cities have come to bear the brunt, so to speak, to respond to people's concerns, to deal with visible increase in encampments. I was just in Edmonton recently, and the city of Edmonton removed almost 10,000 encampments in 2024. So this is a very, a number that needs to give us reason to develop guidelines and supports for cities and municipal workers and really think about how do we address homeless encampments. And again, I always want to highlight in a way that ensures people's safety and well-being who live on the streets and is also receptive to other people's concerns.
Right.
So the lecture will end with some suggestions for policy and practice, again, based on the research that my team and I have done over the past few years.
Oh, it's going to be great. I'm just wondering, as we've been talking about, it's such a nuanced, and there's so many angles, and it's not black and white. There's so many shades of gray. Is there going to be a Q&A portion on Tuesday?
Yes, and I always look forward to that the most, actually. So yes, yeah.
Put you on your toes.
Yeah.
The lecture, Homeless Encampments and Community Wellbeing, sounds super compelling. Do you yourself have a goal for the lecture? Like, what do you hope people who attend it will walk away with?
Well, different things. I mean, people come there with different backgrounds and knowledge and, their own sort of thing, what they would like to get out of the lecture. So whenever I give a talk, I am, very excited to present data and to tell other people's stories. So my goal is to really showcase some of the interview data that we've collected and to make sense of them, and hopefully also to start a discussion. So as I said, I'm always so excited to hear about other people's thoughts, and I'm also always very excited to be challenged by people and get tough questions. So in addition to me talking about my research and showing our findings, I very much look forward to a productive discussion, and I always leave with new thoughts.
New ways of viewing things.
Exactly,
yeah. Katherina, it has been so great to have you here. It is a topic I could talk with you about all afternoon. The lecture on Tuesday is going to be both thought-provoking and excellent. Thanks so much for taking the time out of your very busy schedule to drop by and talk to me today. It's been fantastic.
Thank you so much for having me. I appreciate it.
For our Classic 107 listeners, the lecture Homeless Encampments and Community Wellbeing takes place this Tuesday at 2 p.m. at the Rady JCC, which is at 123 Doncaster. For more details, visit radyjcc.com or go to classic107.com. I've embedded a direct link to the registration page in the article that you can find there. Katherina, thanks again.
Thank you.